Okay, we're at the top of the hour. Good morning and good afternoon, depending on where you are. I hope everybody is having a good hump day. Thank you all for joining our webinar today. My name is Bill Glowacki, and I'm the VP of Sales here at Vivid Supply. As a trusted PPE supplier, we appreciate the opportunity to provide you with education and insights regarding evaluating gowns. I'm joined today by our Gowns and Apparel Product Manager expert, Philip Lee, who will be leading the main portion of today's session. Phil, would you introduce yourself?
Yeah, thanks, Bill. I'm Philip. Feel free to call me Phil. I'm from the product management team here at Vivid Supply, and excited to walk you all through isolation gowns today as we wrap up our final education webinar of 2026.
Hey, thanks, Phil. I'll begin with a brief overview on Vivid Supply and a few instructions, and then I'll hand it over to Phil, who'll do most of the heavy lifting here today and take you through the content. We'll have time for questions at the end of the webinar, so feel free to add your questions to the Q&A box on the right-hand side of the screen. Keep an eye out for pop-up windows on the right-hand side as well, where we'll be sharing additional resources for you to browse at your leisure. And lastly, if you run into technical difficulties, please leave a message in the chat and a member of our team will assist you. Now, Vivid Supply is the biggest PPE provider you've never heard of. 1 in 5 single-use gowns used in North American hospitals come from our manufacturing facilities. That's over 100 million gowns per year. Backed by 30 plus years of high quality self-manufacturing, we focus exclusively on what we do best: gowns, masks, and gloves. So that's it for me. Take it away, Phil.
Awesome. Thanks again, Bill. So today we're going to walk through the full landscape of isolation gowns, what's happening in the market, how designs are evolving, what the standards require, and what to look for when selecting the right gown. The goal is to leave you all with a practical framework that you can take back to your teams. So why do gowns matter? We spend a lot of time talking about masks and gloves, but gowns are often treated as an afterthought. You grab what's on the cart, you put it on, and you move on. But the reality is, gowns are a critical component of any infection prevention and control program. They serve as one of the primary barriers between clinicians, patients, and potential exposure. Specifically, gowns protect against 3 key risks: the transmission of microorganisms, exposure to blood and bodily fluids, cross-contamination between patients and staff. These aren't hypothetical risks. These are things your teams are navigating every single day. And in patient isolation and clinical settings, that protection extends in multiple directions. We're protecting patients against infection risks, particularly immunocompromised individuals. We're protecting clinicians during direct patient contact, and we're protecting staff in high exposure procedures where the risk of fluid splash or sustained contact is elevated. So before we kind of get into design features and standards, it's really important to level set on the different materials that are used in isolation gowns, because material choice is really what drives baseline performance. In the hospital, we typically see four primary material categories. On the left, we start with spun bond or polypropylene. This is your most basic option. So it's breathable, it's cost effective, but really only suitable for minimal or no fluid exposure. You'll typically see this in very low risk environments where splash isn't a concern. From there, we move on to SMS, or spun bond, melt blown spun bond. This is probably the most commonly used material in healthcare. It offers that balance of fluid resistance and breathability, making it suitable for moderate risk environments and extended wear. The third one there is film or polyethylene, which is fluid impervious. It provides a very high level of protection against fluid exposure. It's often used in high risk settings, but the trade-off is breathability, as it can be pretty heavy and warm for the clinician to wear. And lastly, we have poly-coated. So that is combining a film layer with a soft inner layer, whether that be spun bond or SMS. These are typically used in higher risk settings where you need both strong fluid protection and improved comfort compared to a regular film gown. I guess the key takeaway with the slide is that no single material is best. It's always coming down to matching the material to the clinical use case, particularly around fluid exposure risk and duration of wear. So we are now moving into gown design, starting with neck attachments. It's a small detail on the surface, but it does have a big impact on both compliance and ease of use. So in the market today, we kind of go by the rules of four. So we see four main types of neck closures. The first one on the top left is probably familiar to everybody. It's the overhead design. This is where you pull the gown over your head with a pre-bound neck opening, very much like a t-shirt. This is the fastest option for both donning and doffing, and it removes the need for tying or adjusting. That simplicity is really driving compliance, especially in fast-paced environments. We then have in the bottom left neckties. This is more traditional two-piece system. While they can provide maybe a secure fit, they are more time intensive and they rely on the user to properly fasten both ties. So in practice, this is where we sometimes can kind of see incomplete fastening or improper fit, which can then impact protection. In the top right, we have tape tab closures. These use an adhesive strip to secure the gown at the neck. They're faster than ties, but performance can vary depending on the adhesive reliability. So we've generally seen a decline in use. And lastly, we do have hook and loop. These offer secure and adjustable fit, which can improve comfort, but they typically come at a higher cost. So they're often positioned as a more premium option. Key takeaway with these neck designs is, they play a direct role in how consistently a gown is worn properly. The easier it is to don, the more likely the gown is going to be used as intended. So many of our slides here today are going to be accompanied with data. We do want to show, real world changes with what we're seeing with gowns overall. And when we look at the full US market over the past decade, the data does, tell a very clear story. That is in 2012, neckties led the market at 44%, with overhead designs close behind at 40%. By 2025, that's completely flipped. Overhead now demands about 81% of the market, while ties and both tabs have kind of dropped significantly. So I guess important to note, it's not a pandemic-driven spike. This shift kind of happened well before COVID. And the reason there is pretty straightforward from what I alluded to before in the previous slide, right? Overhead designs drive compliance. So the faster they are with don and doff, they're simpler to use, and they reduce the risk of improper fastening. On top of that, we saw significant growth of film gowns and more cost-effective overhead designs. So that really drove tabs and ties out of the market. Now, last characteristic slide here, I promise. Another rules of four, and in this one, we'll look at cuff styles. So that's another design detail that has direct impact on performance and protection at one of the most vulnerable points of the gown, which is the wrist. So we start with the top left with thumb loop. This is a pre-made opening that anchors the gown over the thumb, preventing the sleeve from riding up the forearm. It keeps the gown securely placed under the glove, which improves coverage consistency. One thing to note, thumb loop positioning does vary by manufacturer. So that's probably one of the biggest complaints or pain points we hear from clinicians is like misaligned or, like undersized thumb loops. In the bottom left, we have thumb loop with elastic, which kind of takes the design a step further. That combines the anchoring of thumb loop with the elastic wrist for a more secure design. The elastic, prevents bunching of the gown material under the glove, which then improves both fit and dexterity. This is probably where you see the most intentional design in place right now in the gown market. In the top right, we have knit cuff. That one, provides full wrist coverage with a thick, stretchable material. They're the most comfortable option, but they do tend to slide up and down the wrist, and they come at a higher cost. And lastly, we have elastic cuff. This is probably your most traditional, lowest cost option. A thin elastic is sewn into the material to hold the cuff in place. The challenge is it doesn't maintain a snug fit over time. It tends to ride up the sleeve like knit cuff, and that is going to create a potential exposure risk. So this is design that's kind of increasingly being phased out of the market. The data in the next slide is going to show us that here. So much like with neck closures, costs have undergone a significant shift in the last decade. In 2012, elastic cuffs dominated 51%, thumb loops at 40%. And to present day, we now have that dynamic flipped. Thumb loops now lead at 63%, and elastic cuffs have dropped to just 18%. So I'd say the change is largely driven by the growth of film gowns again. Due to their cost efficiency, thumb loops is really the only design we see with film gowns. At the same time, you see that dark blue piece of the pie kind of increasing there. That's thumb loop and elastic cuff. As I mentioned, it's kind of the best of both worlds, and that's what we tend to see now in most AAMI rated gowns. We'll discuss that later. And then knit cuffs, pretty consistent, staying in that 5 to 6% bracket, typically tied to the comfortable premium designs. So yeah, overall, market kind of has prioritized the need for more secure and compliant cuff designs versus the traditional elastic cuff. So I hope in the last few slides there, it's shown that gown design really isn't evolving randomly. It's being shaped by clear clinical and operational needs around compliance, fit, and performance. So with that in mind, I do want to walk through what purposeful design looks like in practice. Because I know, our organization best, I'll use Vivid Supply as an example to just highlight the types of features you should be evaluating when choosing an isolation gown and why they matter. This isn't about one manufacturer in particular. It's that clinicians and procurement teams should, be more mindful of the design features in the gowns they're selecting. That's ultimately going to decide protection, usability, and compliance of the hospital as a whole. So there's small design details at the cuff that have direct impact on barrier integrity and donning efficiency, two areas often overlooked in gown evaluation. So our cuff attachment, which is our welded elastic cuff, that features welded seams, and that eliminates the pinholes that are created when elastic is sewn, typically seen in traditional designs. So that means there's no micro openings for fluids or contaminants to pass through under the glove, which is a meaningful improvement for barrier integrity. This is particularly relevant to infection control teams, and it's something that we often see go overlooked until it's pointed out. The design on the right is our aligned thumb loop. So it features a thumb loop that's ergonomically aligned, meaning when the gown is donned, thumbs slide right in without adjustment or twisting of the sleeve. So this may sound pretty minor, but as mentioned previously, misaligned or undersized thumb loops are often one of the biggest complaint points from clinicians. And that directly affects donning speed and overall user experience. And then just want to talk about two more kind of purposeful design choices here at Vivid Supply pertaining to the neck closure and the belt. Again, those are two features you don't necessarily think would matter. Our land bridge design features a narrow continuous connection at the top of the neck. What this does, it concentrates all the doffing force at a single point rather than distributing it across the shoulders. So with traditional designs, that pressure can cause tearing at the shoulder or the chest area, which then creates a contamination risk during removal. So this design eliminates all of that entirely when doffed correctly. The feature on the right is our side attachment belt. So belt placement is something that's easy to overlook, but it has a real impact on back coverage. So gowns with belts that are placed in the front of the gown often make it difficult to achieve full back panel closure and only allows for the clinician to tie their gown in the back. Instead, our side attached belt naturally pulls the back panels into an overlapping position when donned, and that improves coverage and reduces exposed gaps. From an infection control standpoint, this is meaningful design because it ensures the back is consistently covered without relying on the clinician to manually adjust. And then it gives them the option to either, tie the belt in the back or tie the belt on the side. So, what the last few slides I hope have really reinforced is that, good gown design plays a critical role in protection, but ultimately design alone isn't enough. So, these features need to be backed by standardized testing and clear performance benchmarks. And that's where things like the AAMI PB70 standard come in. They provide the framework for how gowns are evaluated, classified, and ultimately selected in clinical settings. So the next few slides should be a quick refresher for those who attended our webinar last year on the ASTM and AAMI update. If not to worry, it's relatively straightforward. So the AAMI PB70 standard is the standard that governs how isolation gowns are tested, classified, and labeled. So for those familiar with it, it's AAMI's level 1 to 4 based on liquid barrier performance. As of July of last year, the FDA did fully transition from the previous standard in 2012 to the current one in 2022. And there's a few kind of key changes worth highlighting. The first is coverage expansion. So previously, only full back gowns could carry an AAMI level claim. Now, open back and non-protective back styles can also be rated. So that ultimately gives more flexibility for procurement to match the gown to the actual risk. Secondly, we have labeling requirements. So packaging must now include a shelf life and clearly identify the gown's coverage style. So full back, open back, etc. So now it's much easier for end users, clinicians, whoever that might be, to identify what they're pulling off the shelf. And the last point is about decontamination gowns. So the new standard formally requires decontam gowns to be AAMI level 3 or higher. So that's really important for any facility that has a sterile processing department. I guess maybe last point as well, overall actual performance thresholds haven't changed from level 1 to 4. It's really just about kind of the scope, labeling, and categorization. It really helps bring gowns kind of to the same level as gloves and masks now. Sorry, I lost my mouse. There we go. The next table should be probably familiar for a lot of people. It's going to go over the breakdown of AAMI ratings levels 1 to 4. So as you move up the scale, the barrier protection increases to match the risk. Levels 1 to 2, they cover your lower risk environments. So your basic care, your blood draws, etc. When we go to level 3, that steps up for moderate to high risk protection. Think sterile processing department, emergency room, trauma. And then we move to level 4. That's your highest protection. So that's typically reserved for endo and GI labs, but we also see that in sterile processing departments as well. I think one thing to keep in mind is the higher protection, or as you get higher in the protection, that generally means a heavier gown. So, if you're defaulting to a level 3 or 4 across the board, when a level 2 would be more appropriate, you're adding kind of unnecessary weight and reducing comfort for clinicians, who may be wearing gowns for extended periods. So kind of our guiding principle of Vivid Supply is, match the level to the risk. Now this slide ties directly back to what I just mentioned in terms of the AAMI standard expanding to claims beyond full back gown. So maybe before we dive into the styles, just want to reiterate, for a gown to be AAMI rated, it's not just the material, it needs to be the entire gown as a whole. So essentially what AAMI calls the critical zones, which is everything that's colored in the diagrams here. So full back on the left, everyone's probably very familiar with that, provides barrier protection, not just in the front, but in the back as well. And then all of those critical zones, so A, B, and C, are considered AAMI rated. So this is your most comprehensive coverage option. We then have in the middle non-protective back. So it looks very similar to a full back gown, but essentially the back doesn't meet AAMI level 1. So while it might visually cover the back, it actually doesn't offer any protection there. It only offers the protection in areas A and B. And then on the right, very similar with the open back design, essentially the back isn't covered, so there's no barrier protection or exposure from behind, only protection for the front in those areas A and B. And then it wouldn't really be a slide without some data here. At a high level, the US market, you can see a significant shift in the last decade, moving from unrated to rated, going from 83% to 57%. Obviously, we have a big move towards compliance, comfort, and protection. And I mean, see to the detriment of that, an increase in AAMI rated gowns. And we'll kind of go into more detail on that in the next slide. So looking at the piece of the pie that is now AAMI rated in the year 2025, we can kind of see some trends here. So AAMI level 1 has essentially been phased out. It simply doesn't offer sufficient protection for most clinical scenarios, and facilities have ultimately moved on in that case. AAMI level 2 is the dominant standard that we see. It holds roughly 94% of the market now. It's really become the universal baseline for routine care because it balances both protection and comfort and cost as well. And hospitals are standardizing around that. Level 3 has dipped from 3 to 2%, kind of an anomaly. I mean, interestingly enough, I think there's some cases that maybe would have traditionally called for a level 3 were maybe absorbed by level 2s just due to cost pressure. But I think with the new standard recognizing cheap and TAM gowns as AAMI 3 or higher, you could probably expect a shift back there. And then maybe the most notable growth here in the table is AAMI 4s going from 0 to 4%. I think facilities across the country are increasingly recognizing the need for higher level protection in high risk, high fluid environments. And then I think maybe a broader takeaway here is, post-COVID, there's a stronger infection prevention focus. There's new guidance now under the new standard and more clarity matching the barrier level to the actual clinical task rather than just defaulting to, one gown across the board. So I apologize, the slide is a bit word heavy. We'll get through it, I promise. I do want to just touch base on chemotherapy gown standards. So it's an area that's evolving quite quickly in the US and, we're worth paying close attention to. So starting with the first one, it's USP 800. This is our, standard that governs safe handling of hazardous drugs. The key requirement here is that chemo gowns must be full back, designed with long sleeves, closed cuffs, and no seams or closures that could allow drug penetration. So that full back requirement is critical. The open back or non-protective back designs we just mentioned before, those won't meet the USP 800 compliance. So, if your facility handles hazardous drugs, that's, a non-negotiable. The next standard in the middle is ASTM F739. This is the permeation test method. This is how you actually validate that a gown material can resist chemotherapy drug penetration. It measures breakthrough time, permeation rate, and cumulative permeation at, this is a number you guys don't need to memorize, it's 0.1 micron grams per centimeter squared per minute. A bit of a mouthful. What is important to take away is that testing is extremely rigorous and expensive. It has to be done per drug, per material under consistent contact conditions. So it's a significant investment for any manufacturer or supplier to pursue. And then the last one we have is ASTM F3267-2022. Bit of a mouthful again. This is a specification standard that ties it all together. So it defines the performance, construction, testing, and labeling requirements for chemo gowns. And it leverages the F739 permeation testing as part of its criteria. So in addition, it does align with USP 800 and the new AAMI standard as well. Just to note, it hasn't yet been recognized by the FDA, but it's something as, Vivid Supply, as we try to be your thought leader in the PP product space, that will keep you informed of any changes via email, social media, etc. I think the broader message overall with all these standards here on the slides is that chemo gown compliance is getting more complex, more specific, and more demanding. It is really worth knowing if your manufacturer is actually tracking and investing in these evolving standards. So another pie chart, I think it's the last one here. And honestly, chemo gowns could probably be a webinar on its own. Maybe it's something we do later in the year or next year. But I do just want to leave you with this data that does align with kind of what we talked about so far. In 2019, 69% of chemo gowns were unrated. So they were permeation tested, but they didn't have any liquid barrier rating. And now, present day, it's nearly equalized. 53% is unrated, 47% is AAMI rated. So I think we can probably say the shift is driven by two things. Post-COVID TP standardization, facilities are, asking why chemo gowns are the exception when every other product is, AAMI rated. And then there's stricter USP 800 compliance as well. So the AAMI rated chemo gown, it answers both the question of chemo drug resistance and fluid resistance. For clinicians handling hazardous drugs in a fluid risk environment, that's protection that matters. And I honestly think with the ASTM F3267-2022, whenever that goes forward, it's only going to continue this trend further. All right, so now we have a pretty clear picture of what the standards require from the AAMI barrier levels to USP 800 compliance. The testing is obviously quite rigorous. The requirements are very specific, and they're only going to get more demanding. So naturally, the next question is, where are the gowns that meet these standards actually being manufactured, and how is that landscape shifting? So the next few slides, I just want to take a look at the global supply picture and what it means for our healthcare system in the US. So quick note here, the data reflects shipments into the United States. So domestic manufacturing isn't fully captured here. We will cover that in the next slide though. Looking at the data, we see China at the top of the list. They do remain the primary source of isolation gowns, primarily right now into the US. We have seen a drop though from 62% to 52%. That's driven mainly by geopolitics and compliance requirements right now. Operationally, they still offer kind of the lowest cost and the most consistent production at scale, which is why they're still at the top of the list. At the same time, a lot of that production is being moved into Southeast Asia. So countries like Cambodia, Vietnam, and Thailand, they're gaining share, largely driven by the need to meet TA compliance for both government and institutional buyers. We do see domestic and nearshore options exist, of course. They do come at a premium due to labor and material costs. I think the biggest takeaway from this slide altogether is it's not about just choosing one region or country over another. It is really about balance. So no single country is going to solve the problems for cost, compliance, or supply. It's about having access to a supplier with multiple manufacturing regions. It's very much a necessity and not a nice to have anymore. Now, when we look at domestic manufacturing of gowns, the story is kind of the same for anyone who attended our mask webinar in April. Obviously, domestic manufacturing, has a role. I think that's something that resonates strongly with me, probably everyone in the room as well, having something that could support, locally. But when we look at isolation gowns, we kind of have to be realistic, especially when we look at cost and availability. So on the price side, domestic gowns carry a higher cost premium. That's, initially off of just labor alone, and material costs as well. They're going to be structurally higher coming to the United States. We see also a lot of core raw materials that comprise of our gowns. So non-wovens, elastic, and film, they are still being largely imported. So even though the gown might say, made in the US, may still have foreign source components, which is worth something, worth factoring into. And then on the supply side, domestic production has grown since the pandemic, obviously, supported by investment and policy incentives. But reality is the output still represents a very small share of US gown consumption. I know I don't have a number on the board, but off the top of my head, maybe like 2 to 3% of our domestic supply right now. And obviously, domestic options play a role and hopefully more in the future. But, at this point right now, capacity isn't necessarily there to, match the overseas scale. It's not something that can be the primary source at the moment. So moving on, semi-last section here, I just want to leave you guys with kind of a framework in terms of choosing the right gown, very much repeating kind of what we've talked about so far. Ultimately, gown selection should always be driven by clinical risk, not by habit or brand, and not for having a single SKU across the whole facility. It should start first with compliance. Is the product AAMI rated and classified under the new standard? And then we should match the gown to the actual procedure type and fluid exposure risk. Obviously, a gown that's used in a routine patient interaction is going to be significantly different from a gown that's used for an IV insertion or hazardous drug handling. Then you need to factor in comfort and duration of wear. Higher protection means a heavier gown. So when you're defaulting to, let's say, like a level 3 gown when a level 2 would suffice, you're not only causing a cost issue, you're also causing a wearability issue. And then don't overlook staff feedback. If clinicians aren't comfortable, compliance drops, and then that defeats the whole purpose entirely of wearing a gown. So bottom line, there's no one size fits all gown. You got to match the protection to the task at hand. And then as we wrap things up here, just want to give you guys a few takeaways from today. For those who are still with us, thank you. I know that was a lot of content to go over. So we have 4 key takeaways. The first being design drives compliance. So the simpler and more intuitive a gown is to use, the more consistently it's going to be worn correctly. That's exactly what we're seeing in the market with all that data I shared with overhead gowns and thumb loop designs gaining market share. The second is match the gown to the risk. So there's all solutions. Selection should be based on the clinical scenario, fluid exposure, duration of wear, and staff comfort, and not just defaulting to one product. The third is the standards are very much evolving, from the new AAMI standard PV70 2022 to USP 800 compliance. The landscape is constantly changing, so staying current ensures you're selecting the right gown and the right level of protection. And lastly, just want to leave you with the 4th point. It's the title of our presentation. It's Evaluate Beyond AAMI Level and Price. I hope in the last 30 minutes or so, I've been able to steer you toward that thought. It's really about looking beyond that, going to the materials, the construction, the features, because they all impact the design and it impacts how the gown actually performs in practice. Before I maybe pass this off to Bill for questions, do just want to let everyone know that we will be at APIC this year in Nashville, June 15th to the 17th. If any of what I covered today resonated, or if you'd like to continue the conversation, I will be there in person, booth 2129. I'm really happy to talk to you guys, continue the conversation on gowns, standards, really anything else on your mind. Maybe not my Denver Broncos, a little too early to talk about them today or this year. I'll pass it off to Bill here. I think we might have some few questions and time for them.
Hey, Phil, really nice job, and thanks for that. Great insights. I think the folks on the call will really enjoy that. We've had a few questions come in, so if you've got a moment or two, maybe we could try to click off a couple, and then those that we don't get to, we'll certainly get back to. First one I guess I would ask is, you mentioned the new AAMI standard now requires shelf life on packaging. What tips can you give us that the procurement can use to help manage stockpiles and inventory?
Yeah, no, that's a great question. So I guess, with the new standard, it does require that shelf life in packaging. From all the research I've done, I'd say most of the manufacturers have settled in the 3 to 5 year expiry range. And it really depends on the material and whether the manufacturer is investing in validating that expiry date. So I guess with most manufacturers having a 3-year shelf life, although you can find some that have a 5, like our AAMI 2 gown. I'd say if you're comparing 2 gowns that are very similar, shelf life is now a factor in play, right? So a longer shelf life means less waste, fewer reorders, and that's going to save costs in the long run.
Awesome. Thank you. With everything happening around the Iran conflict and ongoing global shipping concerns, are you seeing any impact on the availability or pricing of isolation gowns or other PPE categories right now?
Yeah, no, that's a good question. I was expecting I'd probably be asked about it. Obviously, I mean, the conflict is something that affects our organization and probably everybody in the US here. And we're keeping a very close eye on the situation, probably, monitoring any impacts. I'd say in terms of the supply of finished gowns, won't be too much of an issue. The raw material that goes into gowns is a derivative of oil, and supply of that isn't really much of a concern. I'd say the only thing that might be a concern is cost, as obviously oil is kind of fluctuating here and there. That might affect the overall finished price, but kind of too close for me to tell there. And then in terms of gloves and masks, I know my colleague Taylor did a very thorough webinar, I think, a couple weeks ago. So we can have that sent out via email.
Great, thank you. How about one more question?
Yeah, for
In
sure.
regards to made in the USA gowns versus what's made abroad, are there differences that we should be made aware of?
Yeah, no, definitely. There should be differences overall beyond just price and supply that I mentioned. I'd say like most of the manufacturing in Asia is very well established, right? They've had time to focus on their designs and focus on scale. Not saying that we can't achieve the same things here in the United States, but it's probably relatively early in the journey. So I'd say if you did have again 2 gowns that you can compare, a domestic and overseas one, just look at all the features I talked about today. It should be pretty easy to see if there's a difference between the two.
Great. Phil, really nice job. Really enjoyed it. If we didn't get to your question, we will certainly answer it. A member of our team will be reaching out to you. And we hope you enjoyed listening to Phil and hearing about this. Look for other webinars from us in the future. Thank you. And I hope you have a wonderful day.
Awesome. Thanks, guys. Appreciate it.